Welcome, everyone. My name is Denise Wilson. I am the Program Manager of the New York State AHEC System statewide office. And again, I would just like to welcome you to the New York State AHEC Dental Residency webinar on loan repayment. I will want to thank Ryan Cassins. I know many of you have been receiving emails from him. He's our Data Technology Coordinator and has really helped us get this going. As a matter of just a few housekeeping items, please place all phones on mute. And this is very important. Group listeners, I know that some of you may be listening in a group of people on one line, and it is very important for me to collect that information just to know who is listening today. So if you can please just email me. You see my email up on the screen. A list of attendees or your name, or if, as I said, one person can send out everyone's name, that would be extremely helpful, and I would really appreciate it. At the end of this webinar, if you can just take a moment to answer a brief survey, just evaluating the webinar, that would be appreciated as well. And lastly, the webinar will be posted on our website at www.ahec.buffalo.edu on March 25th, 2013. I will send an email out to all attendees letting them know that it is available. So on behalf of Dr. Jay Kumar, the Director of the Bureau of Dental Health, New York State Department of Health, and Mary Sienkiewicz, Director of New York State AHEC System, we would like to again thank you for your participation today. The New York State AHEC System mission is to enhance access to quality health care and improve health outcomes by connecting students to careers, professionals to communities, and communities to better health. I would like to start off by showing a brief video of the University of Buffalo initiative that has impacted a community of children in need.
Well, we had heard that in St. Louis that they were organizing a Give Kids a Smile Day, and so I thought that Buffalo being such a large city and knowing that it is one of the poorest cities in the nation would be perfect for such an event.
I want to really just recognize the University at Buffalo School of Dental Medicine for their commitment to children's dental health. In addition to giving kids a smile, you're also focusing on whole body health.
Open big, say ah, big like a lion.
I think it's really important because a lot of children don't have access to regular dental care, and especially the younger ones, some parents might not have them at the dentist yet. So this gives us an opportunity to look around, make sure everything's developing right, and send them home with some information for their parents.
This was the first time we've seen the dentist since we lost insurance last year, so I think it's great.
We're up to 700 children hopefully this year, 2 sites and actually 2 days as well.
I'm here with Bethel Head Start. I'm a parent. We came over to give the kids a nice clean bill of health for their teeth and to get checked up as well.
It's really all about having that first experience in the dental office be a positive one, because that sets the tone for the rest of your life, whether you're going to be afraid of going to the dentist or whether you're going to love coming to the dentist.
It's incredibly important because kids, especially young kids from 0 to 5, the decay rate has increased lately in the last 10 years. And this is one way where we're trying to teach the kids and their parents how important it is to see the dentist.
Let me see your teeth. Ooh, nice. Do you feel better?
Being an excellent dentist does not just mean being able to do excellent clinical work. It also means being excellent to your community. So we're teaching our dental students that giving back to the community is a way of defining excellence in their profession.
Today's probably the best day of the year for me. It's great when at the end of the appointment they're giving you high fives and hugs and they're just happy about the whole thing.
certainly UB is helping us to transform the city of Buffalo, Erie County, and the Western New York region, and it is an essential institution in the Buffalo community.
Whether it's the 2012 University of Buffalo Give Kids a Smile campaign or the S-Smiles to Go mobile dental program, which has served the oral health needs of the rural Chautauqua County children for over 15 years, there are hundreds of areas just like these that will welcome your very valuable expertise. Without further ado, I would like to introduce Dr. Kudjakar, known lovingly by his pediatric patients as Dr. D, Doctor of Pediatric Dentistry at the Family Health Center of Harlem, to speak on his experience as an NHSC recipient and as a dentist in underserved communities.
Hello.
Dr. D?
Hello, good morning, everyone. So I just want to tell you a little bit about my experiences as a National Health Service Corps Scholarship participant. I applied for the National Health Service Corps when I was in dental school at Tufts, and I heard about it during my first year at Tufts, and I applied and I got accepted. I actually applied for the scholarship program, which is a little bit different from the loan repayment program in that they pay for your schooling up front and return you for as many years as they pay for school. You have to return that by working in an underserved area for an equal amount of years. So I applied my first year, and I was accepted into the scholarship program. And it was great because Tufts is a private dental school, and as probably most of you guys know, you can incur a lot of loan debt when you're there, and so they paid for the last 3 years of my dental school up front, and they gave me a stipend for living expenses, and they paid for my books and everything. So that, I continued through dental school normally like anyone else, and then towards the end of dental school, I decided to pursue a residency program in pediatric dentistry. The National Health Service Corps does allow you to defer your obligation to them for a residency program, but I believe it's only for pediatric dentistry or a general practice residency, a GPR. So then I went ahead and did my pediatric dental residency at Long Island Jewish Medical Center in New Hyde Park, which is right on the border of Long Island and Queens. And I did that for 2 years. And towards the end of that residency program, the National Health Service Corps works with you and contacts you because they realize that your time is ending in school and that you need to find a placement, find a job. And they actually do have a conference, and we met down in Tampa at a conference where they had other recruiters, other community health centers, agencies, people just looking for dentists or doctors or whatever that they need on a national level. So they work very hard to help you find a placement. After you finish your residency or dental school, whatever it may be, they do leave you a window of about 6 months to find your own position. I know a lot of people, when they apply to programs with the National Health Service Corps, they get a little nervous because they're like, well, what can they assign me anywhere in the country? Am I going to end up in the middle of nowhere working? What if I have a family and I'm obligated to them? There are a lot of positions out there, and they work with you, like I said, and they give you 6 months to find a position on your own. And if you don't find a position on your own, then they will assign you somewhere. But most people I know usually do find a position within those 6 months. They have lots of they have positions posted on websites. They have a whole department to help you with that, with finding a position. In addition, they also will help cover your expenses if you need to go to an interview or things like that. So it is quite helpful. So after I finished my residency in Long Island, I found a placement in Connecticut. I wanted to stay in the New York City, Connecticut area. So I found a placement in Bridgeport, and I worked for a year as a pediatric dentist in a community health center in Bridgeport, Connecticut. It was an interesting experience. Bridgeport has a large Hispanic population. I would say almost 80% of my patients were Hispanic. And I spent most of my days, actually I learned quite a bit of Spanish. I am definitely not fluent in Spanish in general, but I learned how to basically communicate with my patients. I'm quite fluent in dental Spanish. And it was quite an eye-opening experience. I really enjoyed it. I felt like it benefited me. Like I said, I learned how to speak at least a great amount of dental Spanish, but I really felt like I provided a good service for the patients that were there. But unfortunately, the center I was working at had some financial issues of their own, and they ended up downsizing. So I again had to look to the National Health Service Corps, and they helped me find another position in Harlem with the Institute for Family Health. So I ended up going to Harlem to fulfill the last 2 years of my commitment to the National Health Service Corps. So I ended up in Harlem, again working as a pediatric dentist in East Harlem, quite different from Bridgeport as far as the makeup of the population, but again an extremely underserved area. I have been working in Harlem for the past 2 years, and I have continued. I have completed my commitment to the National Health Service Corps, and I am continuing on here with the Institute for Family Health. It's a great organization. They allow me. Not only am I working in Harlem, I work at some of their other centers. Again, they're a community health center. Their mission is to serve underserved communities. They have sites in the Bronx. We also have developed a school-based health clinic so we're going to be opening that up soon at one of the local elementary schools here in Harlem. And again, it is a very worthwhile experience. I'm not going to lie and say it's always the greatest thing in the world, but like you probably saw in the video, it is very rewarding for me as a pediatric dentist because for the children who are in pain or who have had bad dental experiences in the past, to be able to provide that service for specialized care, for them to be able to see a pediatric dentist. A lot of times parents may have bad dental experiences of their own in the past, and they may translate those to their kids. So you're working really hard to try and combat that. And educate the parents as to the importance of dental health for themselves as well as for their kids. It's a constant battle, but like I said, there are lots of rewards. You do get fulfilled when you see a child that was scared initially to come to the dentist, that you're able to get them out of pain, and it wasn't such a bad experience. So to me, that's the most rewarding aspect of my job, being able to work with kids and help kids. That's a very rewarding aspect. Sometimes it can be very frustrating to work with parents that sometimes don't put the emphasis on dental health that you'd like them to do. But you have to realize that, like people have different priorities, and they may not be able to prioritize dental health or their own health for that matter, because they're working to try and just support themselves. So you really have to work with that and be mindful of that. And you know, so it is very different from, like, say, working in a private practice setting. But you do see a lot, and you get a lot of experience. And like I said, it can be very, very rewarding for you. So that's pretty much my experiences. If you guys have any questions, please feel free to ask about the process or about my experiences as working in Harlem. Hello?
Now would be the time, if you are on mute, to unmute if you have a question for Dr. D.
You said that you were able to work in New York right after dental school. How are you able to, or after your residency program, because I'm doing this AEGD program, but it seems like I would have to wait a while before I would be able to do this type of program in New York.
So you would be applying as a loan repayment?
Yes.
You would have to apply to the loan repayment program, and it does take a little bit to get accepted. Like, for me, the difference was that I applied for the scholarship program while I was in dental school. But the loan repayment actually offers a little more flexibility than the scholarship program. The scholarship program, they only allow you to work in some of the more needy areas. There's a score called the HIPSA score where they rate each area where a center is located based on its need. And loan repayment recipients can work in areas that are less needy than scholarship recipients. So a lot of times when you're looking for jobs, you can actually find out if they have, like for us, when we're hiring, we let people know that we are a National Health Service Corps site, and that we do offer, or that the National Health Service Corps will, offer loan repayment to our dentists and our physicians. So when you're applying for a job, also when you're obviously going to apply for the loan repayment program, but when you're applying for a job, you can ask for that and see if they offer it, and if that's the case, then you'll be set once you get accepted into the loan repayment program.
Okay.
If you go on the National Health Service Corps website, they do have a job database where you can enter your zip code, and it will show you a list of available positions based on HIPSA score. You tell them if you're a loan repayment recipient or a scholarship recipient, and it will list whatever, a bunch of positions, most of them in community health centers, that are available for right now.
Okay.
Hi, it's Dr. Steve Auerbach here with National Service Corps Regional Office. At some point, I can chime in and supplement everything that's being said. Just tell me when.
Okay.
Dr. Auerbach, if you have a response to her question, we do have time for that.
Okay, I didn't, just want to know where it was appropriate to fit in. So, as was being suggested, the scholarship program, which kicks in, you apply for early in your school years, is quite different than the loan repay program, which is after you're a fully licensed clinician and out there already in a position. So, for the scholarship program, like all things in government, it has changed quite a bit over the years. We provide very, very hands-on active assistance for the scholarship program in finding that initial position. And as was mentioned, including we pay for the travel for at least one interview, as well as travel for relocating if there is any relocating. It's not northern exposure. We're not making anyone go off to Alaska. Folks can find positions with our help, nearby or in the place that they want to go to. Generally within, say, a 50-mile radius or less, certainly in urban areas. If you absolutely have your heart set in only Manhattan, well, I can't promise you're not going to be in the Bronx or Brooklyn, but you're not going to be going to North Dakota. But remember, the scholarship program is only for those early, coming into dental school first year or maybe second year. It's a minimum of 2 years and no more than 4 years. It's all the money up front, tuition, all educational expenses, plus a monthly living stipend. But it's less than 10% of our total program at this point. The loan repay program, as I said, you come out, you've already got your license, and you're looking for a position. And really, you're applying to us for the loan repay after you've already got a position at an approved site. And I should say probably half the sites or less even are federally qualified community health centers. We have many, many sites that are other kinds of entities, but they are, of course, all outpatient ambulatory care. But the point there being that the site has to already be on board with us as a site before you are applying as an employee of that site to us. I should mention the institute where the prior speaker is at. I mean, you want to talk about being at a prestigious, high-quality institution. Certainly the institute is that. I mean, they're involved in academic training. The head of the institute was on President Obama's select committee for implementing electronic health records. So, if your interest is to be connected to a high-powered, go-getting institution, certainly you can do that with the National Service Corps. The flip side is we even have private practice sites. So you can be in your own private practice as a National Service Corps loan repayer, potentially, as long as you follow the site rules. One other item I just want to clarify, that Jobs Portal is a very valuable tool. It actually lists all sites, whether or not they have gotten around to posting an open position. So it's actually, in a sense, even more useful than was being suggested, because lots of sites, as you probably know from any jobs bank, lots of sites don't always keep the job bank part up to date. And lots of sites are in a position where, boy, if somebody wanted to come to them, they would probably find a position for them. So it's useful to find all sites in your geographic area of interest, and then to start saying, hey, I'm available, are you hiring? Rather than just the small number that actually have bothered to get around to posting an open position or not. And I'll go back on mute.
Yeah, I saw that because I was looking on the website, and there's only like 2 I saw in New York. So I didn't know if maybe people just haven't posted it yet, and that was one of my concerns, was that it says that you would have to start, or I guess you'd be starting July 15th. Applications due April 12th or something like that. But because, I don't know, because if you're doing this community dentistry, if it would just be easier to be able to get in right away, or you'd have to still wait for your certificate for your residency program to clear.
Yeah, you would be in next year's cycle, it sounds like. You actually have to be in the position, you have to actually be in the position already, finish with your residency, fully licensed, have the position lined up at an approved site, and then, the cycle opens usually in the late fall or early winter and runs to the spring each year. And it sounds like you would probably be in next year's cycle if you haven't quite finished your training and you're not quite at the point yet where you've got a position. But you're absolutely right that there's far more places that have jobs than are posting as having open positions on that website. That website's new. Not everybody's using it as actively. And the way job websites work, they're never up to date, and they're never complete. The main point there is it's all available sites, and use it that way, not the open jobs thing, which is a tiny fraction, and frankly not true. There's a lot more jobs than are posted.
What I think, this is Denise again, what I think may happen is some of your questions may be answered in the following presentations. And also for more specific questions, you can always email me, or I can provide you with the contact emails for National Health Service Corps for either Dr. Auerbach in particular or someone else that could help you with that. Okay? And for the interest of time, we just have to keep with the agenda. But I do want to thank you for those questions and Dr. Auerbach for your responses. I also want to take the time. I know he may have to leave to thank Dr. D for his presentation and sharing his experience with us on the call today. So I want to thank you very much, Dr. D.
You're welcome, and just to chime in a little bit, Dr. Auerbach is absolutely right. Actually, he helped me find my position. I'm glad to hear your voice, Dr. Auerbach. But again, when I was looking, I ended up, calling community health centers listed on their website, even if they didn't have a position listed, and asking them if they had open positions, and I did find quite a few that did. So it is a very useful tool.
At this time, I would like to I would like to introduce Dr. Ron Salick, Vice President of Dentistry with Morris Heights Health Center, Bronx, New York.
Good afternoon, everybody. Thanks for attending the webcast today. I'm going to discuss the possibility of careers in community health centers. This first slide is just showing you our particular center in the Bronx, New York. And I have to get philosophical for about 2 minutes, if you don't mind. It'll help us, sort of put this in perspective. When you were graduating from dental school, or when you were in dental school, there was sort of a confusion as to exactly what the dentist does. In other words, what is the role of a dentist? Are you a service person? Are you a doctor? Are you a health professional? Are you a business person? Are you a cosmetic person? Are you a smile designer, etc.? And these things don't always go together. They're somewhat different from each other, and also sort of lead to different career directions. So when you're thinking about a career, possibly in community health centers, you really have to say, well, what's important to me? Is it important, for example, that I provide a service? Is it important to me that I use the skills that I got while I was in school? Is it important that I'm a doctor, or called doctor, and the prestige that goes with being a doctor? Is it important for me to pay off my loans? And I can't hear anybody in the audience there, but I can tell you that paying off the loans is probably a very important thing for most people who are several $100,000 in debt, if that applies to you. Is it important to you to make a fortune? Then you might want to get off the webcast now. Is it important to have a good lifestyle? Is it important that you make a difference in people's lives? And community health center dental career will address many of these things, but maybe not all of them. So final bit of introduction is when I was myself graduating, we got a guide to dental careers. It was by one of the big corporate dental products companies, and it said, here's what you can do when you get out of dental school. You can open up your own private practice. You could be an associate in somebody else's practice. You could do dentistry in the military. You could go into academic dentistry in a school, or you could work in a hospital. As I found out some 24 years later, which is about where I am now, there was a whole world of dental careers called community health centers that were not in here, and I'm guessing that for many of the people on the call, they're unknown to those people as well. And hopefully by the time the next 10 minutes are done, you'll be familiar with community health centers as a career. So that's where we're headed. So to give you a background on community health centers themselves, because it may be totally new to you, Community Health Center is a not-for-profit organization They are generally mission-oriented. The mission, of course, is generally overall health care for the community that they're situated in. They are sometimes totally independent. For example, ours is independent with its own board. They may be affiliated. Sometimes they're hospital affiliated. But the main point is probably mission-oriented and not-for-profit organizations. They often have dental, I'll put dental first, and medical, social services, behavioral health, many other community services in some sort of mix, but these are usually found, in all of the community health centers. Each one is really different from each other. They have their own style, personality, maybe service set, etc. But this is sort of a description of what a community health center is like, at least the things that they all have in common. And of course, they will serve primarily low-income patients. They were set up essentially to provide medical services to people who are either uninsured or on Medicaid as an insurance, or are low income, or are working poor, etc. So, however, just to show you how nice some of them are, here's a new building of ours across the street where we have some of our radiology specialty services, etc. So I don't want to give you the idea that community health center is going to be in a rundown building in a bad part of town. They are usually and often thriving organizations. Anyway, this is just a quick example of some of the community things that we do outside of dentistry. This was during the swine flu epidemic, where we were doing a swine flu immunization pod, etc. So it is coordinated medical, dental, mental health care for the people in that community. So there are probably, this is, sorry for the old data, but there's probably, several hundred more, but about 1,100 community health centers, 800 of them with dental services, and 2,600 FTE, full-time equivalent dentists nationally. It's probably up to 3,000 by now. So there is a large number of centers with a large number of dental practices, and they do need a large number of dentists. Some people might be thinking that, maybe this is something I do for a year or two while I get myself started, and then I quickly switch out of there and get to a private practice. But that's not necessarily the way to go. In fact, I'm trying to make the case that it's not. This slide is out of date. I think I'm pushing 24 now at this particular center. Many of my docs are long-term career people as well. Some of our GPs are 19, 20 years. Some are 5 or 6 years. We've hired a few recently. The point I'm trying to make is that it is a potential career. It's not just one crazy person like myself thinking that this is a career. There are thousands of people who have decided to go in this direction, and there are good reasons to do it. We have long-term support staff as well, assistants, front desk staff, because the organization that you work for can be a good place to stay. Our pediatric specialists, in case you think it's just GPs, we have a pediatric dentist who's been with us probably, I guess, is now 15 to 16 years. So there's got to be some reason why people would want to do this, and in order to do that, or to answer that, I'll talk a little bit about what a typical community health center dental practice is like. Contrary to what you might think, where you might think it's all emergencies and walk-ins and people are swollen and in pain, generally they are more like a family practice. In our center, probably 80 to 90% of the appointments are regular patients, appointed with, routine services, scheduled services. Of course, there are walk-ins, as there are in any practice. The patient pool is low income and is generally Medicaid covered or self-pay with limited income, and it does certainly influence the mix of procedures clinically that you're going to do. So that we do a tremendous amount of diagnostic, preventive, restorative, endodontics. We do oral surgery, extractions, a a lot of removable. We don't do much smile design. We don't do implants. We don't do much fixed prosthodontics. It's just not the nature of what our patients need, can afford, or can be covered. So you have to go into the career thinking that you're going to be doing bread and butter dentistry for people who need the services. Okay, so if you're headed towards smile design, you probably are not a good fit. Here's just, that's actually kind of a fake picture, but it's one of our residents in a typical room at our center interviewing one of our patients. So the practice and lifestyle, generally regular hours, full-time. We in particular like full-time here rather than part-time. You're salaried. You may have loan repayment. Many of the centers are qualified for loan repayment programs, and you're going to get a really good intro to loan repayment programs with Caleb and some of the other speakers will talk about it. There are both state and federal loan repayment programs. And if I've been putting anybody to sleep, I think you probably just woke up right about now. So loan repayment is in addition to your salary. You get a full salary, and in addition, the state or federal government will help pay back your loans, but that's for another talk. And in addition, with the regular hours and salary, you get excellent benefits. Again, you know, medical, dental, paid, CME, your malpractice is covered. I could go on and on, but it's a very benefit-intensive kind of career. Anyway, now the lifestyle part of it, depending on what you like, is that you do dentistry and you use your skills and you see patients. You do not have the business or practice problems or responsibilities that go with a private practice. Now, again, you may like this or you may not, but you don't have to be involved in hiring staff and firing staff and filing the insurance and buying the equipment and repairing the equipment and doing the scheduling, paying the lab bills, paying the supplies, etc., and staying up all night, running the business, and then all day seeing the patients. Patients are often appreciative of the work that you do. Patients are patients all over, so they vary, but you will get many appreciative patients who really are happy that they are able to get the services that you offer. And you do make a difference for a lot of people who really need these services. Again, just a quick picture there of our operatory. Sorry about the little unpainted spot on the wall there. But anyway, generally, like I said, well-equipped, but bread and butter type dentistry. So almost finally, what are we looking for from our point of view? You know, we're not like desperate to get people. We're looking for somebody who is a good fit. So we would like you to have good clinical skills. That's the bottom line. We'd like you to have an interest in people and in providing those skills to people who need them. So compatibility with community health center work is very important to us. We tend to not want to get somebody straight out of school. We would like a residency completed, mostly because you sort of have to hit the ground running, and you will be doing, you know, somewhat difficult cases, and you know, we'd like that experience. So that's not a rule, but certainly we like it. Many of the health centers would like you to have a residency done, and we'd like somebody who's possibly interested in a career with us. We're not looking for what we call LRP and out, meaning it doesn't help us if you come in, sign up with us for 2 years, get your loan repayment, and then leave to set up your practice. That, you know, that doesn't help us or the patients. So we're looking for people who think that this might be the way to go with their dental career. Typical benefits, probably almost universal: 4-week vacation, sick time, personal time, medical, dental, life insurance, disability, malpractice, all paid for by the organization. Most places give you 3 to 5 days of continuing medical education and some money to do it. Remember, none of this is going to come with your private place. All sick time and personal time is on you. All vacation time is on you. CME is on you, etc. We have 2 retirement plans, one that the organization contributes to, plus a 403B plan. So you can also prepare for retirement. It may not be around the corner, but you need to think ahead. So benefits are generally very good. Again, there's a recent renovation in our place. It's not usually that empty, but you can see again these places can be very nice, modern places and pleasant places to work. Almost finally, then, professional growth in community health centers. If you come in as a dentist, if you would like to head towards administration or being the director of the program, that's one thing you might do. Many CHCs are involved in school health programs, and many CHCs get involved with research or involved with the medical unit and medical dental projects, grants. If you have an interest in accreditation, Joint Commission or state or city accreditation, preparation, site visits, infection control, safety, etc. Those are all areas that the dental people may head towards as professional growth. And so finally, the community health center really could be an excellent career choice for you if you are the right person. And then again, it may not be. It's definitely not for everyone, but it might be for you. So you could use your skills, make a good salary, have excellent benefits, have some good paid-for time off, have a good lifestyle, make a difference to people who need your service, and possibly repay your loans. So it is possible that your future niche is community health center dentistry. So I'll pass this back to Denise.
Thank you very much, Dr. Salick, for your presentation. Does anyone have any questions right now? If you do not, or you would like to hold them for later, there's his email address on the screen, or if you think about it later and you don't have this email address written down, you can email me and I will forward it on. But I thank you again for your presentation. Any questions? Our next speaker is Dr. Justin Herbert from, who's the dental director with Hometown Health Center in Schenectady, New York. Dr. Herbert?
Hello, can everybody hear me?
I can hear you.
Okay, good. Am I going to take control here, or got it? All right. That's up and running, Denise? You can see that?
Yep,
okay.
We got it. Okay.
So my name is Dr. Justin Herbert. I'm the director at Hometown Health Center, which is up in Schenectady, New York. We are a federally qualified health center. We serve a tremendously underserved population. We are only one of very few Medicaid providers in Schenectady County. Very urban setting, high need, low dental IQ population. My email is on the screen, and also my phone number. If you have any questions afterwards, I probably won't be on till the end, but if you have any questions, feel free to email me, call me, or email through Denise. So I went, my presentation and Dr. Salick's probably could be mirror images. We serve the same population. We do the same type of dentistry. We're looking for the same person. And just as Dr. Salick said, community health centers are not for everyone. A little about myself. I went to Temple University, came out, did my residency at St. Peter's here in Albany. Worked at St. Peter's as a staff dentist, as an attending dentist for their residency for about 3 years. Also worked part-time private practice in that 3 years. And between the two, that's when I really realized that community health center dentistry was my cup of tea. I enjoyed it. I enjoyed it a lot more than the private practice aspect. You know, some dentists enjoy, like Dr. Salick said, doing smile design all day. I enjoyed taking out teeth. I enjoyed making removable, and I enjoyed the patients a heck of a lot more. So what do? We are FQHC. We serve a very low-income population. We also have a medical site downstairs. They have fully staffed with family practice doctors. We have an OB. We have social workers. We have pediatricians. So we're basically the health home for most of our patients who we see. We do see urgent care population. We have a certain population that is just episodic. We have a non-compliant population, obviously, that we deal with, which is some of our hardship and headaches. But with more of us, like Dr. Salek said, with growing numbers, that's going to decrease, and that is our goal. We do some walk-in care. Part of the job that I love is that you never know what's going to happen when a patient walks in the door at a community health center. Every day I think I could tell a story. You can see a couple patients here that are, I picked out of my x-ray history that I, keep some neat x-rays aside. One gentleman took a bullet to the wisdom tooth down here. And this little gentleman was a 16-year-old who had braces on for 6 years and never got care. And these people need our help. They literally have nowhere else to go. And that's the population that we serve. That's what I enjoy doing. And it is a very specific type of practitioner that we're looking for. And I think Dr. Salek hit it on the head when he said, you either know that you want to be a private practice dentist or a community health center dentist. And just because you are a community health center dentist does not mean you are lower class, does not mean you don't do the same dentistry. As you can see here, we do have a low-income population, but we have a sliding fee, which allows a lot of our patients who could not afford care at a private practice office to afford care and to get root canals and crowns and stuff that they may not be able to get at other offices. We are 65% Medicaid. We have about a 10% self-pay population, and they are subject to the sliding fee. We also house a residency program through Lutheran Medical Center, which I think is a terrific way for a resident to learn. As you can see, this patient was just in the other day. We see patients with very complex dental needs. It's not just nuts and bolts, drill and fill. We see a lot of patients that need a lot of work, and it's quite enjoyable. The patients are very appreciative. The work is very rewarding. To turn a patient from a complete dental phobic who has never been to the dentist in 20 years to somebody who enjoys coming and can smile again. Regular day, we do see walk-ins. We see, we have most of our schedule is regular care patients. We do a lot of removable. We do a lot of fillings and restorative. We do a lot of oral surgery and extractions. We do a wide range of everything. We see a lot of kids. We also, it's almost like I planned this with Dr. Salek. I've never met him before, but as he said, the things that we can offer a dentist are numerous, and the benefits are for some people a lot, outweigh private practice a lot. We have loan repayment, like Dr. Salek said. They're going to speak today, the National Service Corps, which I'm a member of. I just re-signed for my 3rd year. We also have opportunities through our residency program through Lutheran Medical Center. As an attending, I have been to many conferences, working on a master's in dental education, all sponsored by Lutheran Medical Center and what they offer through the residency. We have completely modern facilities. Our chairs and our equipment are better than most private offices that I've been into. We are completely electronic. Our scheduling, we have digital x-rays, we have digital chart, which for me, we're way ahead of the curve. Most of the, like I said, most of the private offices that I've been in are not as technology advanced as we are. And most people, when we have people come in, are very impressed and actually are actually surprised at the level of technology that we have. We have a digital Panorex. Literally everything is on the computer. We have tremendous benefits, days off. I mean, federal holidays and all that stuff that Dr. Salek went through are great. And they provide a lot that you do not get through a private practice. We have incentive plans for providers that produce well, and I think we're a very good workplace. We have very low turnover. A couple of our dentists have been here for, one is 23 years, one is at 18 years, one is very part-time, has been here for 5. One we just hired out of her residency. She finished her residency through Lutheran here, and as soon as she finished her residency, took a job. And we also have the residents. So we have 6 full-time dentists, or I'm sorry, 5 full-time and 1 part-time dentist, and we work in a busy place. The staff is awesome. Completely like the staff here at the community health center, more than the staff that I've seen at private offices. For me, it was a no-brainer. Like the dentistry, like the patients, like the facilities. And I think it is a very specific person that we're looking for, a person that knows they want to give back, they want to help. Their benefits like loan repayment come with it, but it does take a certain kind of person to work here, and it's very rewarding. And I, like Dr. Salek, would say that it's a great idea for anyone. I do get loan repayment through the government, and it is a nice benefit. But that's not the only reason I'm here by far. I like it and I enjoy it, and that was my presentation. Once again, if anyone has any questions, feel free to contact me. My email and phone number are there, or contact me through Denise.
Thank you very much, Dr. Herbal, for your presentation. It was very informative, although I don't know if I understood a lot of those x-ray pictures, but I would hate to be on the other end of those, I can say that. But thank you again, and as the doctor just said, if you do have any questions or just want to pick his brain about working in the community health center or with the underserved population, feel free to contact him or myself, and we can get your questions answered. Next, we have a presentation from the National Health Service Corps, and let's see where we are. Just a second. I'm sorry. Okay, from Caleb Wistar. He's the Associate Director of the Division of Workforce Development, Office of Primary Care of the New York State Department of Health, and also Dr. Stephen Arbach, who's Captain of U.S. Public Health Service Division of Regional Operations and Bureau of Clinician Recruitment and Service with the Health Resources and Services Administration. I believe Dr. Arbach is going to go first as we give him control of his own presentation slide.
Hi, everybody.
There we go.
Arbach here. Can you see my slides?
I think we can.
That was a yes?
Yep, you're all set.
Great. Hi, guys. So I'm here to talk about the National Service Corps overall, including some of the folks, give you a sense of the numbers of who's in New York State. And then Caleb will come in with the New York State specific program. National Service Corps, of course, is the national program. So I'm a federal bureaucrat down in the regional office in New York, and I work jointly with Caleb. And those of you in New York State are very lucky to have Caleb as your New York State bureaucrat. He's great. So we're here to talk about the National Service Corps, the national program, as well as the New York State Primary Care Service Corps, which is the state-specific program that's separate. And there. I'm having a little trouble with the advancing here. Okay, there it goes. So again, National Service Corps is a network of now over 10,000 primary care, oral and dental and mental health professionals across over 14,000 sites nationwide. Currently, there are 3 different programs under the National Service Corps rubric. There's the scholarship program, which is how we started, but is smaller now. That pays for you while you're in your case, is dental school, pays full tuition up front, educational expenses, and a monthly living stipend, all up front, in return for a year for your service. So if we paid for 3 out of your 4 years of dental school, then you would owe us 3 years afterwards. We have the Student to Service Loan Repay Program, which is new in its 2nd year, and right now is only open for medical students, MD or DO, but not for dental students. And then we have the largest part of our program in terms of numbers of people, clinicians that we're supporting, is the Loan Repayment Program. That one, you're already finished with your training, you're a fully licensed professional, you've made a linkage with a National Health Service Corps approved site, either as a full-time already employee there, or at least you've got a contract in hand with them at the time that you're applying with us. And then if you're accepted to our program and you're working there, then we're giving you money against the loans that you already accumulated, which, by the way, include not only your professional school loans, but also your undergraduate loans. So any of the schooling that was required to lead to your clinical license, we will cover. So traditionally, your pre-dental, pre-medical, pre-nursing, pre-PA, as it were, undergraduate, as well as the professional school. History of the Corps, there was a realization in the 50s and 60s that a large cohort of clinicians were leaving, retiring. I always joke Marcus Welby was going out of business, but nobody remembers who Marcus Welby was anymore. And was leaving the country without primary care services, particularly in what were already otherwise underserved areas. Like any federal program, waxes and wanes over the years, but has experienced large growth under the current administration, first with ARA, the stimulus package, and now also with the CARE Act. We've more than tripled, actually. It says doubled there, but it's actually more than tripled if you actually look at the numbers overall from 2008 to 2011. And we are now probably at a new plateau for the time being, somewhere around 10,000 to 11,000 folks in our current field strength. You can see here the breakdown of physicians and mental health providers, as well as both dentists and dental hygienists. I would say we're probably trying to push it a little bit fewer percentage of mental health providers and a slightly higher percentage of the other categories as we move forward. The bottom line is a new plateau based on our current levels of funding, but we hope for continued expansion as the CARE Act, so-called Obamacare, continues to roll out and expand. We know that there's going to be more and more people who have access as far as insurance, and hence more primary care demand, but they still need to have clinicians that will take their insurance and will be able to provide care for them now that they have that increased ability to pay, but may still be in areas where they're not otherwise clinicians, or clinicians will take the insurance that they have. Those 10,000 clinicians are serving over 10.4 million people in the United States. Certainly the largest group, plurality, but by no means majority, of National Service Corps sites are the community health centers, the federally qualified health centers, community health centers, healthcare for the homeless, migrant health, school-based health, healthcare for the homeless sites. But we have many, many other sites we will see. I don't mean to undercut the federally qualified health center colleagues on this call. That's one option. It's a great option. It isn't the only option for National Service Corps. We do have data that show that this allows for folks to have a happy and long-term career. We hope we are self-selecting for folks who want to do this kind of work, and that we are merely adding the additional incentive for the ability for them to do what they really wish to do. Everybody, when they go to health professional school, at that interview says, I want to help people, and hopefully that includes helping people, not just wealthy people in well-to-do neighborhoods where there are an abundance of clinicians and patients who can pay very, very well easily, but includes all persons living in America. So what we have shown is that a large majority of clinicians are actually still serving in shortage areas 15 years later, not necessarily at their original site, and in fact, a large majority, if you look a year after finishing their obligation, are still at the same site. So both are true. Folks are settling in, they're making roots, they're making a life, they're making a career out of it. So in New York State, for example, we have, I'll get back to what the health professional shortage areas are, but basically they are the designated areas, either a cluster of census tracts in the most urban areas like the Bronx, or a county or a part of a county in the more rural upstate areas. Based on the data, if we needed another 292 dentists to provide the minimal need throughout New York State, if it was perfect distribution, into those already underserved sites, we would still need 292 more dentists to provide minimal levels of care. We, in fact, have 58 serving in those HPSAs through the National Service Corps program, 49 dentists, 9 dental hygienists, 18 in New York City, and 40 serving throughout the rest of the state, as we say. So the National Service Corps Loan Repay program is the largest one, as I said before. We also have the scholarship. And basically the idea here is you sign an initial 2-year contract, you agree to work at a place that's an approved site, you get your full salary and benefits as an employee of that site, and then in addition, you get $30,000 a year for 2 years to pay off against your loans. And then you can keep signing up year after year until all your loans are paid off. We all have a full-time and a part-time option, so it can be full-time, that $60,000, $30,000 a year for the first 2 years of the contract is based on the full-time. If you do the half-time option, it's either half the amount of money for 2 years or the same amount of money over 4 years, allowing you to work 20 hours a week instead of 40 hours a week. But the bottom line is we don't want people doing it just for the money. We hope that this is helping you be re-incentivized to do the work you wanted to do anyway, but for which perhaps the fear of having to pay off all those student loans was driving you in a different direction. And so we're here from the federal government. We're here to help. So again, the point is you're getting your full salary, full benefits as you would from your employers. They would have to pay you based on your license and experience, anyone else, whether they were in the National Service Corps or not. And then in addition, that added recruitment and retention incentive, you're getting the money to pay off the loans. The current amounts, and of course this changes potentially year to year, going up slowly as there's inflation and cost of living and so forth. Currently, in recent years, it's been 60 years for the initial 2-year contract. And after the 2 years, you can sign up for 1-year continuation contracts. And the way it works, if you go to the website, is it adds up to $170,000 over 5 years, but somewhere around $260,000 over 10 years. And that should be able to pay off even the most expensive private school loans, we hope. Here's a breakdown of how it works. For places to be a National Service Corps site, in other words, a place where you would work, they have to agree with us, just as you're agreeing to take the money from us in return for working there. They, as an approved site, have to agree to certain conditions with us to be an approved site. That includes, as all of the health centers do, to take public insurance as payments in full, to offer the sliding fee scale discount for the uninsured based on a table that we mandate, which is down to $20 or less for a visit, for everything done at that visit. And in addition, they have to be in one of these designated shortage areas. Now, the designated shortage areas fall in, first of all, any given location is either designated as a shortage area or it doesn't have a designation. So, for example, the areas where the two health centers that spoke earlier, they're designated, rural and urban. But obviously, let's say Beverly Hills or, in California or Midtown Park Avenue in Manhattan, not designated. But even within a designation, you could have a low score of, say, 0 or the highest score of a 26. The higher the score, the worse off that area is in terms of its health professional shortage needs. The higher the score, the higher the need, and with limited taxpayer dollars, we want to incentivize folks to go to the higher need places. And so we've put a priority now on sites that have a score of 14 or greater for the loan repay program. You're more like, if you're working at such a place and you apply to us, remember you have to already be at the site, and you apply to us at a place that's 14 or greater, you're a higher priority for us to say yes to, number one. And number two, if you do get in, you get more money. If you're applying from a place 0 to 13, and let me preface that by saying really 9 to 13, because less than 9, nobody's getting funded anymore, unless there's a much greater pool of money in future years than there is currently, then you're less likely to get in at all, and if you do get in, you would be getting less money. We want to put the taxpayer dollar to work where it's needed the most, and that's the higher HPSA scores. So, you know, in addition, there's various benefits of being part of the network, being part of the National Service Corps. There's a potential for doing teaching. There's potential for various virtual and face-to-face professional networking. We have various CEU, and of course, rewarding patient relationship with folks who really need your care. And again, a chance to be part of something bigger than just yourself. Eligibility, U.S. citizens or nationals, currently working or applying to work with at least some documentation of agreement between you and the potential employer at the time of your applying. And of course, that you got loans. These have to be real loans. Can't be from bank of mom and dad. They can be commercial loans. They can be government loans of other sorts. Other reasonable educational expenses and living expenses related to your education. And they have to be segregated from other debt. So you don't put in your mortgage, don't put in your car loan. It has to be just the educational loans. But they can be loans from multiple different sources as long as they're the educational loans. And of course, you have to be licensed to practice in the state where your employer is located, which you do anyway. I would also note, since I'm dealing with this issue now, from lots of desperate phone calls from loan repay applicants, yes, the site you're working at actually has to be a National Service Corps site already at the time that you're applying. Eligible disciplines across all of our program includes MDs and DOs, nurse practitioner, nurse midwives, and physician assistants, what we refer to as primary care. Under dental, the dentists, either general dentistry or pediatric dentistry, being the specialty we allow, as well as dental hygienists. And then under mental health, psychiatry, psychology, various other licensed mental health. So where would you work? What are these National Service Corps sites, and what are those HPSAs? Well, this slide up here shows you what every single National Health Service Corps site looks like. That's exactly what every single one looks like. Well, perhaps not. But the fact is that, in fact, in many communities, you know, we keep talking about, oh, these are rural communities, these are poor communities. Well, that's kind of true by definition in terms of there being a shortage area. But quite frankly, a lot of places The health center site is one of the nicest, newest buildings in the area. And many of them really are modern and up-to-date. They've received all kinds of funding. They were ahead of the curve compared to most sites on electronic records that has been mentioned. In the Bed-Stuy neighborhood of Brooklyn, there's a new community health center. That's the biggest, largest, newest thing in the neighborhood. Similarly, in Camden, New Jersey, and we've heard already from our two earlier speakers. So, and I should mention my wife works at one too. So, National Service Corps sites. Remember again, the site is your employer. It's kind of a three-way relationship. The site has a one-to-one relationship with us, the National Service Corps. They have to follow our rules. You, as the National Service Corps obliged clinician, have a contract with us initially for those 2 years, or payback for 2, 3, or 4 years as a scholar, as the case may be. One-to-one relationship with us. And then also, you have an employee-employer relationship with the site. Many, many kinds of places can be sites. So in addition to the federally qualified health centers that we've mentioned, the second largest group, certainly in New York State, are the hospital-affiliated primary care outpatient clinics. So any of the hospitals in your community may well be, especially upstate, many of the community hospitals are, and in New York City, many of the, not only the public hospitals, but actually many of the private voluntary hospitals, based on where they're located, are also sites, not the inpatient, but the outpatient clinic and the network of affiliated, hospital-affiliated clinics. So that's probably the second largest. We have school-based clinics. We have Indian Health Service, a few in New York, many more out west, of course. And then we also have federal correctional and state correctional, but not city or county prisons, and even private practices. So I know of at least one case of a dentist straight out of dental school opening up his own office, his own chair, his own operatory in a neighborhood in the Bronx, applied to be National Service Corps as a site, applied National Service Corps for loan repay, and is operating his own private practice on that basis. Still has to agree to our rules, be located in a shortage area, take all public insurance, and offer the sliding fee scale discount to the uninsured. Not eligible, inpatient, hospital, hospice, long-term care, places that don't offer ongoing continuity of care, like urgent care clinics, triage ERs, specialty care, and county, city, local correctional. Sites, again, talked about the eligibility, have to be in a HPSA, and then once in a HPSA, have to then follow those other rules, primarily regarding public insurance and sliding fee scale. So, as a clinician looking for participate in this, you know, are we going to make you go to North Dakota against your will to find a site? No. There are many, many, many sites all over the country. General rule of thumb, half are in rural areas, half are in urban areas. On this slide, you can see throughout New York State, under dental, there are over 570 dental sites in total. We fully acknowledge that 312 are in that 9 to 13 range, and 196 are in that over 14 range, which is really the critical one for the National Service Corps Loan Repay Program, and 147 sites throughout the state above the 16 range, which is what you need for scholar placement. So again, is it an infinite number of sites? Of course not. Is it a large number of sites? Yes. Are we going to make you go to North Dakota against your will? No. Can I guarantee you that in any given discipline, in any given year, that there will be a position just in the exact location you want? No. Can we be pretty assured within a 50-mile radius? Yeah, probably. Within a 1 or 2 hour drive commute at the worst, yes. In the city, which is what I deal with mostly in New York City, I can't guarantee you Manhattan, but Manhattan, Brooklyn, Bronx, Queens, we'll find you a place. So where do I find these sites? Well, you can go to the public website, nhscjobs.hrsa.gov, and look at it. It's a Google Map developed database that lists, and here's really the key point, despite the name NHSC Jobs, it actually lists all active sites. And the reality is many sites that potentially have positions, if you ask them, don't post to the site saying, hey, we have a job at this moment. The site's new, people are still getting up and running on using it. So the key point is use it as a listing for all sites. This is the slide for the Bronx. And basically there's, across all professions, primary care, mental, and dental, there's 216 sites in the Bronx. I think we can find you a job. So you can just go to the website, plug in what you want in terms of location. You can drill down by your field of practice, let's say dental. You might want to limit it to just 14 and above, and it will still be a pretty large number as long as you're not limiting yourself to too small a field. So what's your obligation? How much do I work? Well, you have a contract with your employer, and that's what you got to work. But for the National Service Corps obligation, you need to work at least 45 weeks per year, times, if you're in the full-time contract, 40 hours per week, of which, in most cases, including general dentistry, 32 hours have to be in that direct face-to-face outpatient primary care at the approved site, and up to 8 hours may be everything else, including administration, work at other sites, like an inpatient site. Now, for pediatric dental, it's a little bit different. I think there's historical reasons having to do with operatory, having to do with this. So it may be less, at the minimum, 21 hours rather than the 32. And then again, times 2 years for the initial contract and then 1 year at a time on the continuation contracts. So where do I find out about all this? Well, you want to get the program guidance. You can go to the website, nhsc.hrsa.gov. There's loan repayment. 2013 loan repayment cycle is open now. So if you were a fully licensed clinician at a job at a site, this is where you would go, or this is where you will go when you're ready for it. If you're in dental school and you want to check out the scholarship situation, you can click here. The scholarship program typically opens in the spring, roughly around the time that professional schools are sending out their acceptance letters. So it's timed to when folks have gotten their acceptance letters to health professional schools and are beginning to figure out how they're going to pay for it. You can apply as an entering first year, but you can also apply as a first or second year. The minimum is for 2 years, so you need to have at least 2 years remaining. And there's your key websites. This is with the one page you'd want to take notes on, HRSA.gov/loan scholarships. That'll get you to the list of everything. All our loan and scholarship programs from there, specifically within that National Service Corps, and even within that specifically the loan repay program. I'm going to turn it over now to Caleb. And go ahead, Caleb.
Okay. We are kind of working in tandem here because I wanted to say that everything that Steve says about the National Health Service Corps is also germane to the New York State Primary Care Service Corps, except for the fact that the NHSC has more money. So here's basically the thing. This program is fairly new. It started last year. We had a budget of $1 million that we hope will fund up to 33 loan repayment awards under the program. And for those of you who are policy wonks here in the state of New York, you probably know that the budget is just about to be passed. We hope it's going to be an on-time budget. April 1st is when that happens, and we hope to get another $1 million out of it at that time. So when I say that the Primary Care Service Corps parameters are, what they are, you will see that it's pretty much the same. Probably the only difference between the Primary Care Service Corps and the National Health Service Corps, again, beside the fact that it has money, more money, is the fact that this only for New York State, and we don't require that the site be pre-approved by the state of New York or the National Health Service Corps or anyone for that matter. And so that's kind of how that works. Okay, so again, exactly like the National Health Service Corps, and again, so these two can be used in tandem. The site has to be located in a health professional shortage area, in your case for dentistry. The clinicians must provide those same exact types of care in the same type of settings that Steve very helpfully and in great detail outlined. But another important difference is, while the National Health Service Corps allows for-profit sites that deliver generic primary dental or behavioral health services, we are not allowed by federal standards, since federal funding is paying half the bills here, for profit facilities. So it must be not for profit. And all the same eligible professions for the National Health Service Corps obtain here. Once again, the eligibility criteria are pretty much the same things that Steve outlined previously. The only difference, again, between the National Health Service Corps and this program is that you have to be employed at an eligible facility or plan to begin work at an eligible facility before September of the year. Like the National Health Service Corps, we allow full or a part-time obligation. Once again, the maximum awards are somewhat similar to the National Health Service Corps. So over 5 years, you would receive a total of $150,000 instead of $170,000, and $75,000 for a part-time award. These, like the National Health Service Corps, are tax exempt, so you don't have to worry about that, and that's kind of an added benefit. The other thing is that it's like the National Health Service Corps. There is a 2-year contract, so you must do at least 2 years, irrespective of your debt. If your debt is $5,000, you still have to get a 2-year contract, and you get $5,000, not the $60,000. These are maximum. Okay, I'm happy to say that, and Steve, correct me if I'm wrong, I know the National Health Service Corps application is still open now, correct?
Yes, correct.
And so we have just released our applications on March 15th. For those of you who are interested in finding out more about this, and I encourage you to find out more about this because there's a lot of details that you have to understand. And I will say that because of the New York State procurement rules, once we establish a question and answer period, and that period ends, this is state law, we cannot answer any questions about the substance of the application. So I urge you to sign up for that webinar by going to the website and checking out the applications and all of that, which is going to be on the website, which I'll give you in a minute. The application period will open in earnest May 1st and close at the end of June, with contracts for those awarded beginning July 1st and running for 2 years. So this is the website. This will take you directly to the Primary Care Service Corps. My email is up top. Give me a call. Once again, I can only answer questions that are related to technical issues, like how many pages is my application, or where's the webinar, and that type of stuff. The webinar sign-up is the email at the bottom. So that's, basically it in a nutshell. Here is the actual Primary Care Service Corps website that is linked to that one that I just showed you. This is what it looks like. The documents are right here. The request for applications, that's the background. The application checklist and instructions are attachment 1. There's a fillable application there on PDF and various things. Here's the sample multi-year grant contract with appendices. I urge you to take a look at that because it has the same default criteria as the National Health Service Corps, and it is quite stringent. So you are urged to talk about and look at that, talk about it among yourselves. Again, we're going to go into more detail on it when we actually have the webinar. So that's basically it from me.
I just want to clarify one thing. You can't double dip. You can only be in one program at a time. So if you are in the National Service Corps, you are not allowed to get a loan repay obligation from another place and kind of serve off 2 obligations at the same time while getting double hits of the money. So, for example, if you are in the state program, then you need to finish your obligation for the state program before you start the national program, and I suspect vice versa.
Correct.
And, if you're already a scholar, you need to finish the scholar obligation before you start the loan repay, although you can roll from one to the other. As Caleb mentioned, these are contracts, and it's a two-way street. You need to fulfill your obligation, and the penalty for not fulfilling the obligation is significantly more than just the money for the remaining time. There's a fancy way to calculate it, but I roughly say think triple damages and then go up. So right. You want to fulfill the obligation. Now, if you become unemployed at the site for whatever reason, let's say you have a parting of ways with your boss, or they're just under financial pressure and they laid you off or went out of business, we work very hard to make sure that people don't go into default. So we've worked with folks for months to get them a new position, in a reasonable location relative to where they were. And there's no cases I'm aware of where the clinician was willing to work with us in good faith that it's gone to default. The ones where it's gone to default and the lawyers and all the bad things are, quite frankly, people trying to skip out.
And I just want to say that Steve is exactly right, and just be aware that what I'm saying here is just scratching the surface. These are just the high points. You are urged in both cases to go to the website, explore it, learn as much as you can about it, because this is a serious obligation with also serious penalties if you decide not to continue it past, more than a few months.
This is Denise, but I just want to interrupt. We did have a question, and I'm not sure if it was answered or not. Someone asked if they needed to have a job before they applied for a loan repayment program.
The short answer is yes. The longer answer is the exact wording of it changes each year, and it's a little more flexible this year than in the past insofar as you need to have some sort of written agreement with a site that you're going to be working there for your National Service Corps obligation. And they need to actually do a certification as part of your application that, yeah, you're going to be working there. Notice my careful use of tenses. Oh, yeah, maybe it's 3-to-1 or 4-to-1 competitive in terms of number of applications to number of folks we fund. And were you not to be funded by us, would you have to anyway work at that site? Well, that's between you and them.
Okay, fair enough.
If you are funded by us, then the site that certified that that's where you were going to be doing your obligation, we expect you to be there on day one.
Okay. Well,
yes.
If you have any further questions, just in the interest of time, if you have any further questions, please, you can email them to myself, or I believe Caleb and Dr. Arbach provided email or addresses for, or some type of contact information.
I'm going to switch back to my screen. I can show you a few things if there's still time.
We have a second. So
let me just say while you're doing that, that it's the same thing for the Primary Care Service Corps. You have to have an employment agreement, and you have to be in place by September of this year. So that's an important thing.
Right. So assuming my screen is up, I'm on the live website for the National Service Corps Loan Repay Program. This current cycle has been open for a while and is open through April 16th. As you can see the deadline over here. You can put in your application here, and right here you can see there's a program application program and guidance, which is a big fat PDF file that has all the details. So there's the eligibility, qualifications, preferences, site requirement for your time you're applying, the service requirement when you're doing it, what happens if you have to change jobs, breaching the contract, suspension, waiver, cancellation, etc., etc. The details are all here, and that's what you should start with.
Okay, then that helps.
And there's the link, and if you go backwards and backwards, you're back at the back there. And again, I just want to encourage everyone. Your easiest starting point for everything is the HRSA.gov main site, all the good things we do, including the health centers. And then if you go to loan and scholarships, there's all the different programs, including National Service Corps Loan Repay, National Service Corps Scholarship.
Okay. Sounds good. Thank you very much, Dr. Arbuck and Caleb, one star again, for your very informative presentation. At this time, we will move to Aaron Norrell from the, New York State Bureau of Dental Health, presenting on New York State Workforce Data Summary. Aaron?
Hey, Denise. Thank you.
You're welcome.
Okay, so as Denise said, my name is Erin Norrell. I work for the New York State Department of Health, Bureau of Dental Health, and I'm just here to tell you a little bit about some state workforce data that we have. So as of January 7, 2013, there are 15,280 dentists registered and living in the state of New York. Compared to 1997, it's decreased. In 1997, it was 16,872. The number of new licenses in 2012 was 597. On the right of the screen, you can see a graph outlining the number of licenses issued over the last 9 years. It peaked in 2006 with a very deep decrease in 2007, and we've slowly been making our way up, but have not reached that 2006 number again. First-year dental students in 2011, we had 445 in New York State. 241 of them were New York State residents, so that's about 54%. So with an additional 112 New York State residents enrolled in an out-of-state dental school. So despite all of these great statistics, we still face some problems with our dental workforce in this state, mainly the aging of the workforce and an uneven distribution of dentists. When you compare all states with dental health professional shortage areas, we rank 9th in the sheer number of shortage areas in the state, and 8th when you look at the total population living in a dental health professional shortage area. So this just outlines a little bit of the age of dentists in New York State. So our median age is 52. That is higher than the median age in New York, in the United States, which is 50. So if we're looking at the map here, white is 51 and younger. The aqua color is the median age of 52. And then yellow is 53 to 59, and red 60 to 63. And as you can see, we have 2 counties in New York State that are greater than the age of 60, Essex County, which is in northern New York, and Allegheny County, which is in the western region. Lewis County is the youngest at 45.5, and as I said, Allegheny at 63. So there really is quite a variance throughout the state. When you look at the regional distribution of dentists in the state, it varies greatly as well. So according to a survey conducted by the Center for Health Workforce Studies, there's a strong variability in the distribution of dentists regionally across the state. As you can see on Long Island, there are 105 dentists per 100,000 residents compared to only 52 dentists per 100,000 in the North Country. And the actual number may be lower due to some dentists not providing direct patient care on a full-time basis. The next slide, the ratios may vary even further when examining populations with greater treatment needs. So this could be our low-income population or Medicaid eligible. This phenomenon is highly highlighted within the rural areas. So this map, or this graph right here, shows all 62 counties and their population to dentist ratio. So that's the total population, Census 2010 numbers, divided by the total number of dentists registered to practice in the county. So as you can see, I mean, it looks pretty good. A lot of them are under the 3,000 to 1 ratio. But when you compare the total population to a specific population, it can vary. For instance, Tompkins County, which has a ratio of 1,847 people per dentist, when you look at strictly the Medicaid eligible population, the number becomes 6,993 people per 1 dentist. Talking about Medicaid, over half of, this is the same study from Center for Health Workforce Studies, over half of New York State dentists report not treating any patients with Medicaid, and only 10% of dentists indicate more than 60% of their patient population is Medicaid eligible. But interestingly enough, 96% of the practicing dentists reported that they have the capacity to accept additional patients. So Caleb and Dr. Auerbach talked about some dental health professional shortage areas in New York State. This is data as of today. We have 121 total designations, 1 geographic, 1 single county, 25 population, and 94 facility. We have just over 1.6 million people living in a dental health professional shortage area, and we would need 212 dentists to remove the designation and 292 to achieve that 3,000 to 1 ratio. So this just kind of shows where the shortages areas are. The checkerboard ones are our population-based HPSA, with the solid gray being our single county and our geographic HPSAs. And this just shows them for New York City, so you can kind of see that even though it's a large metropolitan area, shortages still exist. Okay, so just to conclude, despite these great favorable population 100 population ratios, when we compare to the nation as a whole, New York has an uneven distribution. Our dentists are older, and there's a definite lack of access to care for our underserved populations. There are many opportunities available. You've heard about some of them today. If you're interested in finding an area, you want to practice in a certain part of the state and this appeals to you, contact your local AHEC. They have health match programs. They have websites dedicated to posting dental positions. So they're a definite asset for you. Also, the New York State Dental Association is happy to help find that right position for you. Definitely think about staying in New York to practice. We need you. So that is it. This is my contact information if you have any questions. Thanks.
Thank you very much, Erin. At this time, this concludes our webinar for today. I do want to just remind everyone to complete the brief survey once you exit out of the webinar. And again, feel free to contact me with any one of our presenters with any questions. Again, I thank you for your time. I thank all of my presenters for their time and their information. And I hope you all have a very good evening. Thank you.